Today we have Michele Demarest. We're so glad she's with us. She actually did partner with us when we went to Westfield, New Jersey last year, and she did the speech and swallowing screenings at our program. So we're really excited that she's back talking to everybody. She is a New Jersey licensed speech language pathologist who is board certified by the American Speech Language Hearing Association and holds her certificate of clinical competence. She also is a certified brain injury specialist and provides cognitive remediation therapy in a variety of settings. She is trained at the second level in the use of prompts for restructuring oral muscular motor targets, talk tools, oral motor placement therapy, and orofacial myology. She has expertise in the treatment of myofunctional disorders, cognitive remediation, articulation disorders, aphasia, autism, apraxia of speech, voice disorders, and dysarthria. I'm messing that up.
Dysarthria. Yeah.
And we're so glad it is May is Better Hearing and Speech Month. So we're so glad she's with us today. I'm going to turn the floor over to her, but just so you know, we are going to be doing some exercises with her today. So we will invite you to come off mute when we do those. So thank you so much for being here, Michele.
Thank you for having me, Eden. All right. Well, hi, everyone. I can only see the first few people. Oh, I see. If I scroll down, I get to see everybody. So nice to meet everyone or see everyone. And what I thought we would do is get started with talking um, about about speech and hearing for Parkinson's with relation to Parkinson's, and then we'll do some exercises um, uh, for speech. And so get your speech muscles ready. So, all right. So my name is Michele Demarest. I have advanced degrees from University of Pennsylvania and James Madison University. And I've been practicing speech therapy for about 20 years. I own a company called Morris Speech Therapy in Morristown, New Jersey. And we provide speech therapy online and in person. And there are no financial interests or relationships to disclose. All right, so let's get started. Not everybody knows what a speech pathologist does, and people are often interested to know all the things we do. So the first thing is we deal with how you speak. That's your voice, whether you have a clear voice, and also enunciation, whether you can articulate sounds correctly. We deal with language, which is the idea of putting those words that you say together to communicate thoughts. Cognition, which is a very large area and includes arousal, self-control, attention, information processing, and memory, problem solving, as well as self-awareness. We also deal with swallowing, which this program is not going to really deal with, but we can talk about it a little bit because it's very important for people who have Parkinson's to understand the swallowing and keep up and abreast of how their swallowing is going. And then also we work with audiologists and otolaryngologists and the whole team that you probably have assigned to you to make sure that everything is working as well as possible. So if you all have speech pathologists, those individuals should be communicating regularly with your team members so that you are getting the best outcomes. Whoops. All right. All right. Oh, so if I just click it once, it'll move forward. Okay. The importance of communication. As we all know, to get by in life, we need to communicate with others. And the question is your communication affected when you have Parkinson's? And what are some of the repercussions on speech, language, and hearing from Parkinson's? So how can Parkinson's disease or PD affect speech and hearing? Speech is the technical term is dysarthria. People may have kinetic or even hyperkinetic dysarthria. That means that you have a monotone voice, you become quiet when you're speaking, you may mumble, which means that you have light articulatory contact with your lips and your tongue. You're not moving it with the correct amount of force. And you may be too nasal. You may talk more like this, or you may talk more like this. And and one important thing is that people have a decreased awareness of the changes in their speech, which is why going to a speech therapist can really, really be helpful. While you may be less aware of your own speech, your loved ones may be very aware of some changes and may be telling you about them. Bringing us to hearing. What happens with hearing is that you have decreased perception. We all have decreased perception in our hearing as we get older, and that's called presbycusis. But then there can also be another type of sensory neural hearing loss that ends up decreasing your ability to perceive and interpret sounds and language. And so that's important to note, and we'll talk more about how decreased perception may decrease your ability to use your cognition. So let's do a quick check. You can unmute everybody at this point. I want to know, and I guess you guys could raise your hands or just say something. How many of you feel like you're talking loudly enough so that others can hear you, so that your loved ones can hear you?
I do.
Me too. And how many people have some questions about that? So I don't know if there's a way they can raise their hands or just call out.
You can also ask a question in the chat if you'd like.
Okay, why don't you ask that question? How many people, if you think about it, how many of you have been told, I can't understand you? You're not talking loudly enough. Okay, I see one hand. Another hand. It's hard to do the math on this, but
Some people said so many times. Someone else said they're told they're not speaking loud enough. Deb has raised her hand.
oh,
So yeah,
sorry
a
about that.
lot of people are having this problem.
Okay, good. Well, that's something to be aware of. Oh, I'm so sorry about that. Okay, we're back to where we should be. And then here's another question. So it's good that there's some awareness about that, because that really is a large problem with Parkinson's. Now, here's the other question is, how many of you feel like those around you have trouble with their hearing? And this is said with a little tongue in cheek. And that's what I often hear when people come in, that my wife needs hearing aids, my children need hearing aids, everybody is not hearing correctly. And it's just something to be aware of, how often a speech pathologist will hear that. As a matter of fact, I often will see women coming in, especially women, because women talk more, right? And they're the ones at the home who might be saying, might be sort of leading more conversations. And they come in with voice disorders, and I say, well, why do you think why do you have a voice disorder? They say, it's because my husband can't hear me, so I have to talk loudly. And as we get older, speaking loudly is much, much, much more difficult. It can be very dangerous for our vocal folds. So that's just something to consider. If you know that you're having trouble with hearing, let's move forward and talk about what that would mean, how you can take care of that. So up to 50% of patients with PD may suffer hearing loss. That's a very large number. As we all age, by the end of life, about 38%. So it's larger than the general population, because people with PD are in all stages of life, maybe starting as early as 40. Hearing loss can be one of the early warning signs of Parkinson's. And not addressing it can make matters a difficult situation worse. So to give yourself the best chances of being able to prolong your communication and functional communication, taking care of your hearing is an important part. Um, let's see. Um, so a more technical thing happens as well. And I don't know if you can I ask, can everybody see the right side of the screen, or is the are the people on the that you can see on that right side of the screen? Even
Most
can
of us, I think, have it up top, so we can see the
okay,
hearing in Parkinson's. Your speech may degrade faster when you have untreated hearing
okay.
loss. You can see the whole slide.
Oh my goodness. Okay. So, okay. Right. So your speech might degrade faster when you can't hear. And that's because there's a feedback loop of what we hear and what we say. And so it's an encoding and decoding issue. Um, why is it concerning to have an encoding problem and a decoding problem? Is because there are some studies that show that cognition or decreased cognition is associated with decreased encoding and decreased decoding. And that's called central auditory processing issues. Um, so for clear communication, you need good hearing. And of course, here's the title. What did you say? And I said, for clear communication, you need good hearing. Um, I'm going to, let's go to here. Some people have questions, is hearing loss a natural part of aging? It is indeed a natural part of aging, but PD makes it more complex because it can result in 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 bringing on cognitive challenges before they would otherwise occur. Does that make sense? And what can you do? Get tested, get hearing aids, use an amplification device, learn communication strategies, and importantly, talk to your doctors, your team about medications, because those can very much change your hearing. And they're not necessarily the Parkinson's disease medications, it's everything else as well. So there's a lot of medications that can affect hearing. So, detecting hearing loss, listen to what people are telling you. The people closest to you will tell you if they can't hear you. And I know it's very often people want to blame them, like, no, you can hear me fine. Uh, but don't blame them. They're not against you. Instead, try to believe them and take some action and make sure you enroll those people as your allies, because it's so important to have someone honestly giving you feedback, right? Because otherwise you might not know. That's part of the challenge of having Parkinson's, is not having as much self-awareness about your speech. And that is because of the part of your brain that's having difficulties. I'm going to stop here for a minute, open it up to some questions if anybody has questions about hearing. I think the next slide is okay, here's more hearing loss slides. I think this is the last slide. If you are having trouble hearing women's and children's voices, especially if you're constantly turning up the TV or the radio and other people are doing this around you, if it's hard to hear the high pitch consonants S, F, T, H, S, H, T, K, and P, if you have tinnitus or the ringing in your ears, or if you think other people are mumbling, or if people tell you you are mumbling, hearing loss could be one of the culprits. So as you look at this, there's 6 things here, and you add up what your score is. And, I would say if you have 1 to 2, you really should think about getting A, remediating your hearing loss, which would involve getting tested by an audiologist. You can go to your otolaryngologist. Often they have a specific, full audiological exam can be done there. Outpatient hospital settings or an independent audiologist. Then, this is really important, talk to your doctor or the clinician about what the results mean. They should do that automatically, but they don't always, you know. The medical professionals are busy. Have someone with you who can help listen and interpret the results if you can. Not everybody's going to have someone, but if you do, you know, really write it down and try to make sure you understand. And the next part would be learn about your choices. You can have, if you needed a hearing aid, there's all sorts of options. You can put a receiver in the ear. You can put a receiver behind the ear. There's all sorts of options for you. And a lot of them are very unobtrusive. And hearing aids nowadays are so much better than they were, you know, even 10 years ago because of the digital nature of them. And you can help control them from your smartphone. Get your hearing aids fitted and then follow up regularly after you've gotten them to figure out if it's working. It's not a one-time deal, you know, as your hearing changes, as your perception of your hearing changes, things may be getting better, things may be getting worse. So don't just take those hearing aids out and throw them away and say, oh, it's not working. That's not how it works with hearing aids. You may have to work on it a little bit. And just so you know, I don't think Medicare doesn't pay for all of the hearing stuff. I think it's important to say that up front so that people know, yep, it might be a little bit of money to get this done, but really your hearing is worth it because look at what it allows you to do. It allows you to live your life and maintain your cognitive status in a manner that, you know, might otherwise be challenging. So, okay, is that finally done? Oh, it's not finally done. Okay, here we go. One more. By the way, if any caregivers are here today, what not to do when you're talking to someone with hearing loss. Do not yell, speak too quickly, or speak too slowly. All of those things degrade the auditory signal. So just know that it's not great to do that. Instead, we want to use some other options to communicate. Writing is fine. Don't try to, as you know, as the wife of someone or a husband of someone, don't try to raise your voice. Instead, let's try to use some other options. And again, speech therapists can help you with that. Audiologists can help you with that and learn communication strategies. So now what I wanted to do, see down here it says wrong. I went to the beach to have a picnic and swim. So that's where if you're running your words together, you're not going to be able to understand them, right? Somebody you're speaking with wouldn't be able to understand you. Well, as we know, with Parkinson's, that also happens when we speak. So the right way to do it is make a nice paced, have a nice paced presentation. I went to the beach to have a picnic and swim. And if we do it nice and slowly, marking each and every syllable, that is going to be more understandable to someone with hearing loss and also is a good model for how they might respond to us because we want with Parkinson's, we want to make sure that there's a nicely paced verbal presentation when we speak. Okay. Okay, so then that's that. So should we open it just for a minute, or I haven't been looking at the chat. Is there anything for me to answer at this point?
No, we're good.
All right, should I continue?
Yes, thank you.
Very good. All right. So for clear communication, you need good articulation. So now we're going to get into the speech side. So like we were just saying, when we speak, we want to have a steady rate of presentation. Instead of picnic and swim, we could say picnic and swim. We want to have optimal placement of our tongue, lips, jaw, and cheeks so that we're using them correctly so that we don't overuse our voice and we are crisply enunciating. And of course, not everybody knows where to put their tongue or lips or cheeks. when they speak. And that's why a speech therapist is so helpful. We know every single sound, exactly how it's made. And it's not that difficult, right? Most you can usually kind of guess, but speech therapists have a deeper knowledge and can help you use certain tools to increase your skill in placing your tongue, lips, cheeks, jaw in the correct positions to speak correctly. The other thing that happens because of the hypo or hyperkinetic dysarthria is that people stop using a steady amount of force when speaking. So instead, they might just talk really calmly like this and that. So, right, they're not using enough force to make the sounds correctly. And in order to do that, we might need to relearn it. The other thing is to have clear communication, you need to have loud speech, loud enough. And here you can see that there's a couple of, oh, sorry, a couple of different options for very soft all the way up to shouting. That slide on the right-hand side is from the Lee Silverman voice technique webpage, I believe. And it talks about how, and they're, you probably all know, they are one of the major modalities for speech therapists to use to help people recalibrate how they speak. And it works on loudness and speaking clearly. What it's saying there is that as with Parkinson's, you are going to have to use more effort to get to that normal voice than before. And in order to do that, we might, a speech therapist can help you, or you yourself could help you do a number of different things. One thing that can happen is, with regard to loudness, is we might have a more stooped posture. We might have difficulty getting that air in, and so it's harder to get that air out. One of the newest, there's a bunch of things that speech therapists can do. One thing I do is hands-on. It's sort of like a massage to help release the tension that you might be feeling. You can go to physical therapy and they can really help stretch this area of the body. Also, in coordination with your doctor, we might use something called the breather. The breather is, I can just show you, it's just you breathe in and out, and it has these dials that help you make breathing that much harder. But it's very good to have strong breath support for speech, and it can help, ward off pneumonia, for example. When you're not getting enough exercise, things tend to settle in your lungs and you're more likely to have a pneumonia. This is used for people who don't have that issue, or there's one that's a green one that you use out of the hospital to help regain the strength, the inspiration and inspiratory and expiratory strength. And so what you would do with this is you just breathe in and out. So I'm on level 3. Um, and that is a great way to start getting that ability to have the strength to speak if you're deconditioned. So that's an interesting little tidbit. All right. Okay. What else for clear communication? The research that has been done shows that you need to speak with intention. This means having conscious control over your muscles of articulation, your cheeks, your lips, your jaw, your tongue, all of that, and even your voice box. A man named Dr. Boone discovered this because he would have his Parkinson's patients, as part of the cognitive testing, you have to speak forward, count 1 to 10 forward. And then the cognitive testing, you have to count backwards to see if you have the cognitive wherewithal to count forward and backward. But what he noticed is that when people counted backward, they were much more intelligible or understandable, intelligible. And so this is typically the case. This is always the case. So I thought we could try that right now. Let's just try, if everybody will, let's count forward at your own pace. I'm not going to count, and you can unmute so we can just hear people count. So are they unmuted?
They can unmute, and I'm asking everybody to unmute.
Okay. Everybody go ahead and unmute.
We also do have a question. What does the respirator do?
The breather,
Yeah.
what it's doing is strengthening the muscles of the diaphragm, and those muscles help pump the air in and out, or bring the air in and push the air out. But what's great, hello, little puppy. What's great about this also is there's some research that shows that if you have gastroesophageal reflux, which most people do at a certain by age 60, you're strengthening the muscles around the lower esophagus. The esophagus is the tube that food goes through to get to your stomach. And there's a sphincter that is loose, gets loose as we get older. And that's what allows stomach acid to go up your esophagus and then often go over into the trachea and get into your lungs. And that's why a lot of people end up with pneumonia, is that they've aspirated their, the stomach acid, basically. Well, because this is strengthening the muscles of the diaphragm, it tightens that sphincter. So that sphincter is less likely to be loose, and you're less likely to have GERD or gastroesophageal reflux, which is really great. So that's also tied to sleep apnea. If anybody has that, that's when you stop breathing in your sleep. And some people may be on a CPAP machine, and this helps with that as well. All right, everybody ready to count 1 to 10? On your mark. Get set.
1,
Go.
2, 3, 4,
1,
5,
2,
3, 4, 5, 6, 7, 8, 9, 10.
Very good. All right. You couldn't really hear.
You do?
Oh, I don't know.
But right, it was the conglomeration. So now the question is, if I have you count backwards, and if you have a caregiver with you in the room, they'll be able to attest. Let's hear if you naturally happen to count more slowly and clearly. So let's get started with that. Start at 10, go back to 1. On your mark, get set, and go.
10, 9, 8, 7, 5, 4, 3, 2, 1.
Hard to say. It sounded better to me going backwards than forward, but I can't. I think I saw at least one person who has a loved one in the room with them. Does anybody have any input about whether it felt clearer to them or sounded clearer? Anything?
Nope, can't tell.
In any case, why is this phenomenon? And so you can, unless everybody, does anybody have anything to add, a chat about? If you want to, feel free to make a comment.
The same gentleman did ask, does the breather help with swallowing too?
It does, actually. I just saw that. So Dennis, I see that now. I've figured out how to see that. It does. And as a matter of fact, we know that it's helping the pharyngeal phase of the swallow, which is when the food gets to the back. Believe it or not. Yep. There is some research about that. So yeah.
Deb did remark that it was much clearer backward.
Yes. Very good. All right. So why did that? Sorry, no. I'm sorry, I have to go back. Okay. Sorry, almost there. All right. I'm there. Okay. Okay. Well, so why was the speech clearer? It's because of the way our brain is wired. There is a system in our brain that relies on the inside communicating with a huge number of other pieces of our brain. And that's the part that at this point with Parkinson's is being negatively affected. Speech is so often considered an automatic task that if we use that automatic part of our brain, it doesn't work as well. But as soon as we use something called the pyramidal track, we're using nerves and that control muscles that are under our control. And so that's what you want to do. And so speaking, having conscious control or speaking intentionally triggers the use of those parts of your brain. And so that's why it works. So to recap, how do you get clear communication? Clear articulation, loud speech, intentional speech, and good hearing. And your best speech, your best speech is at the intersection of all of those things. So how to speak. So there's two main programs that are used. One is Speak Out, and that was developed by the Parkinson's Voice Project. They're the ones who have all the information about intentional speaking. And their answer is to how to speak slowly, use intention. Loudly, use intention. How to use more force? Again, use your intention to do so. And they have an intensive program. And you would do it with a certified instructor. Intentional speech bypasses the affected circuitry in your brain to use fewer pathways to allow you to speak loudly and clearly. Another one is called the Lee Silverman Voice Technique, LSVT. And this one trains people with Parkinson's to use their voice at a more normal loudness level while speaking at work, everywhere. Key for them is recalibrating what you, as somebody with a moderate level of Parkinson's, believe is loud, what you believe is slow and a slow and paced rate. So that's really what their program's working on. Basically, both programs work on the same thing, just from a slightly different perspective. They, you may have heard of them, and I wonder how many people have. They want you to use big and exaggerated movements of your mouth, loud, have a loud voice. They know that by doing this, you can re-energize your voice and overcome a lot of the issues you're having. All right, so let's try it. What I'd like to do, and we can, why don't we unmute everybody for this? I want to just show you what is the basics, what a session might look like if you came to any therapist. One of the first things we're going to do, well, one of the first things most people will do is do some warm-ups on your face, some touching, some relaxation. The next thing we're going to do is and making sure that your posture is good so that there's none of this. There's not this happening. As much as you can, you're sitting with your head level, your shoulders are rolled back, you're sitting in a relaxed posture with your feet flat on the floor, and there should be a 90-degree angle between your hips and your legs. Your elbows are resting nicely on your chair. So the first thing we're going to do is just open up our mouth and say, or we'll breathe through our nose. Ah. Keep on going, keep on going. Yep. It is. Very good.
Yes, I'm coming. Okay.
Okay.
I was just unmuting.
Now the next thing we're going to do is say that was at a single note. Now we're going to go up a scale. Let's start low, go up. Let's publish the side. Very good. You can use your hands, right? Some people who may have not, who might need therapy, you might find that you can't go up. So this is how you go up. That actually will help stretch your vocal cords. This is how you go down. Even if you're not being able to move your voice, you can literally move your head to move your voice. Then once we got to the point where we're, where we're speaking, we're able to move our voice without moving our heads, and that's great. Then you can just keep your head relaxed. Very good. How did that feel for everybody?
Good.
Fine.
Good. Great. Okay. The next thing we're going to talk about a little bit is breathing. There's two levels of breathe, or there's two different ways most people breathe. One is like this. If I say take a deep breath, they go, well, you know, that doesn't look very good, but people do it. What we want you to do is belly breathe. We want that muscle of the diaphragm when you breathe in, it's pulling down. And so that's why all of this talk about, which you probably have heard about core strength, go to physical therapy, make sure your core strength is good so you don't fall. Well, from a speech pathology, a speech perspective, we want to make sure that you're using your diaphragm and you can support that breath for speech. So one way to do it is just put your hand right on your belly button, relax, and see if you can breathe without moving your shoulders. What you're going to do is close your mouth, breathe through your nose gently and in a nice long way, and then see if you can push your stomach out as the air comes in. So go ahead. And now hold it. Now go ahead and let it out. 1, 2, 3, 4, 5. All right. What we do in most speech therapy practices is you're going to do some meditative breathing to get used to that. We know that you're able to concentrate more, have more nitrous oxide in your body. And if you take in too much oxygen, you have less nitrous oxide. However, if you take in less oxygen and have a very paced breathing method, you have more nitrous oxide. There's a great book, which I recommend to everybody, called Breath, the new science of a lost art, something like that. Fascinating book, worth a read. And at the back of that book, they have do-it-yourself breathing exercises. He talks all about his journey about learning how to support people through breathing. But very interesting. All right. The next thing we can do is articulation drills, and we would do a lot of this, learning how to say different sounds. So what we have here is the P versus the B. And those are called bilabial sounds. That's where you put your lips together, bilabial. And one is voiced, where you turn on your voice, and one is voiceless. I don't know if you guys can hear that. That's a voiceless sound. I did not turn on my voice. I just said. And if you were in my office, I'd have you guys get a tissue and say. So if you have a tissue, you can pick it up and do it. And we would juxtapose that against ba, So, oh, I gotta hold on one second. Okay. Let's do it. Let's do it together. Ba,
Ga.
ba, ba, ba.
Ga.
And so those are the same, the exact same sound, but one you don't turn on your voice and one you do. The next one we'll do is the K versus the G. So, and ga. And ga. And see where my tongue is? And ga. And I'm here. I'm here. It's not pressing against my teeth. The little retracted, the back goes up. And ga. Go ahead. Ga. Ga. Good. Ga. One more time. Ga. Ga. Good. Very good. Very good. The last one, so that was called the K versus G is called a velar sound because it's in the back and you have to use the back of your mouth with the velar area. Okay. That also is one that some of you, if you've had swallowing issues, you know that people sometimes still use that to help train swallowing a little bit. There's some research saying that that works and some that says it doesn't. Next one, I'm taking the tip of my tongue and putting it behind my teeth. The P sound. And that's voiceless. Just, and again, we can do this. Not ta, but good. Good. And now we're going to juxtapose with da, 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 da. And so those are called, what I just gave you are called minimal pairs. There's just one thing different between those two sounds. But that's why speech therapy can be helpful for you. If you can remember what's the one thing that's difference between a P and a B, and you habituate that action, then your speech is going to be clearer, right? So you can know, oh, that's a P word. They didn't understand me. Let me make sure I did not turn my voice on. Peter, not beater, right? All right. And there's lots of other things we could do with articulation. The last thing is to say some loud phrases. Then what we would do is we would say some loud phrases to a beat, making sure that you're saying each and every syllable. So I don't know if you guys read there was an article where PMD Alliance had interviewed me. It was very kind of them to interview me. And in that article, I made a sort of a joke because I had somebody with Parkinson's in here. And we have to think of 10 phrases that he uses at home that he wishes his wife would understand when he says. And then we have to say them. We have to say them 10 times loudly. We have to say them very loudly at about 80 to 90 decibels, which is very loud. It's sort of as loud as you would hear a plane taking off. That's how loud it is. And so one of his phrases was, "Where are my shoes?" So we sat in my office asking that question 10 times repeatedly, right? Which I still think was very funny. I kept wondering if people were going to come knock on the door and say, "They're right here. We've got your shoes." Anyway, didn't happen. Let's say these phrases. And what we're going to do, if you look at these funny phrases I wrote, if we say them quickly without specific pauses between each word, they're going to make a whole nother sentence, a whole nother word. So let's start off by doing it with a beat. Okay. Thirds, teeth, or stay. Let's all do it together. 1, 2, 3. Thirds, teeth, or Stay. Very good. Very good. I wish everybody who came to me was as good as you guys. That's great. All right. Now, what would that sound like if we ran it together? Can anybody tell me what it's going to sound like? Say it a couple of times.
Thursday.
Thursday. Thursday.
Thursday.
Tuesday or Thursday?
Thursday.
I think it says thirsty Thursday. Like the day that you go out to the bar, thirsty Thursday. You could hear it, right? That if you didn't do it with that pacing, somebody might be thinking you're talking about going out to the bars. Let's do the next one. These if kill war. So go ahead, do it with me. These if kill war. Of course, it makes no sense, right? But what would that be if you ran it together?
These are for war.
These are war.
The Civil War, right? The Civil War.
The Civil War.
Yeah. So interesting, kind of fun. There are games that you might play in therapy. One's called Mad Gab, and the other's called I don't know, something like Unbeatable. But they have these types of tricky sayings. Make sure that you're saying them correctly. With the different types of therapy, they're pretty intensive. And the one for LSVT is 4 days a week for 4 weeks, 16 sessions for an hour. And then the one for Speak Out is not as intensive as that. Something to know about this is some people think, well, here's the question, right? How bad do I have to be to go get speech therapy? And that may be the wrong question to ask, right? Not how bad do I have to be? What they know, what these two places both say is if you get started on it now, you will have the best outcome you could have for the longest amount of time. So it may behoove you, and I've said this when we did our screenings, to get started now. You know you have the diagnosis, right? What can you do now to get to that point where you're optimizing your function? You know how to speak and you continue to do it. So that is absolutely something that insurance will pay for because you have the diagnosis, right? Nobody can say you don't need this therapy. You do. And the research is there to back it up. That if you do this and learn this, you're going to surpass what your function would have been otherwise. So, so I think that's that. Any comments or about this at all? Let me check. Oh, that was nice.
There was a question asking, what does research say about which method, meaning intent or loudness, is more effective?
Oh, I guess I don't believe there have been. Sorry, let me go back. I don't believe that there have been comparative studies that I know of. I don't know. But the long and short of it is both of them are having you be loud. And both of them pull on intention. You know, when you do the LSVT, being able to speak with intent, nobody uses that word, but you're basically being told, now take your time, think about what you're doing. So it's the same thing. I think what the question could be is how much therapy do you need? The way LSVT does it, they're more intensive. And I think it's probably if you're moderate to severe, you might want the LSVT. But I'm guessing if you are not, and you're just sort of at the mild to beginning to be moderate stage, and you're thinking, I don't really need this, but now Michelle's told me that I could benefit from it, you might want to go with the Speak Out. Now, let's talk a little bit about, I don't know enough about Speak Out to know if there are OTs and PTs who also use some version of that. I've never heard of it. With LSVT, your occupational therapist and your physical therapist would also be in on the action. Your ideal is you go to speech therapy to learn how to speak loud. You go to physical therapy and occupational therapy to move big. And then you practice these techniques, excuse me, at both speech therapy and occupational therapy. So one man I had here took this part and really did it. We would go and he or two, both men really took it to heart. They were going and getting their physical therapy, big physical therapy, and loud speech therapy with me. And we would walk around doing big movements while speaking, and using the whole brain to integrate those actions. And so big therapy is something that you should know about. And that's definitely been proven too. It was thought of by it's LSVT big. They were the same, it was the same people. They thought of the speech stuff and then they realized that it would carry over into physical therapy.
You have one more question. What do you do when drooling interferes with speech or like excessive saliva, for example?
Then, so let's talk about that. So what I didn't put in here, because it's Better Hearing and Speech Month, is I really didn't focus on the swallowing, but we can. And that's what that brings us to. If you're drooling, the question is, do you really have excessive saliva or are you just not swallowing as often as you should? You should be swallowing once a minute at least. How are you swallowing? Is your tongue forward? Is your jaw open? Right? If I sit around like that and don't swallow, I'm going to drool. And so when that starts to happen, you know, that's a good time to go start the therapy. I use all these tools that help me measure how strong you are and make sure that you get to the point where you are strong enough to be doing the things you need. But we would use, we would be working on making sure that you're swallowing and reminding yourself to swallow. To do a mature swallow, around 5 months of age, our tongue, when we're little, we protrude our tongue to suckle at the breast. And then at around 5 months of age, we start to retract our tongue to swallow. And so it goes in, back, and up, in, back, and up. We smush it against the top of our mouth. We suction the food, saliva, or whatever back. With Parkinson's, if you allow your body to become deconditioned, or, you know, it depends on what stage of the disease, you're not going to be able to suction swallow as well. You're not going to be able to elevate the tongue as well. And therapy can help you do those things. And once you do those things, it's going to be should be much better. You know, you can have other swallowing deficits for sure with Parkinson's. Different parts don't move as easily. Something called the epiglottis might not close over the trachea to protect your lungs. So that's something that you would need to, that any speech therapist would make sure to find out before they start doing swallowing therapy with you. Let's talk a little bit. I think I've already done this. Well, not yet. With both speech and swallowing therapy, you need to go to a doctor beforehand, and not just any doctor. For the speech therapy, I need you to go to an otolaryngologist, an ENT, and they need to rule out that you don't already have a voice disorder. A voice disorder is when you're using you can use the external muscles of your neck to try to talk. And often that happens because the muscles of of speech, the glottis muscles, are very small and weaken as we age. And so in order to, well, and then on top of it, you have the Parkinson's. So in order to get through that, people start using more force and they might be talking a little bit more like this. Did you see all this get bunched up and tense? So we want to and then they can get vocal nodules, they can get all sorts of issues. So what we need to do in order, we're not allowed to do it until you've gone to an ENT who's cleared you and said, you're good, go get speech therapy, because we need to know what we're dealing with before we start messing with it. And then the same thing with feeding. It's, you wouldn't necessarily go to an ENT, although you could go to the ENT. At the same time, they could do a laryngoscopy, which is where they look down your nose and they look at your vocal folds and they record what they see. They could do that, and they could also look at your swallowing. Usually the speech pathologist at that practice would do that. They would do something called an FEES, a FEES, a fiber optic endoscopic evaluation of speech and swallowing. I can write all this down too. Let me know if I should write it down, but that would be, it's probably the easiest thing to do. You go to your otolaryngologist and say, I have Parkinson's, I want speech and swallowing therapy. They need a prescription. Please do a FEES, FEESS. And then they would do it. Then they would release you to go ahead and have your speech therapy and your swallow therapy. Sometimes, if you're really having swallow issues, then we're going to get worried and we're going to send you off to a hospital, or usually it's the hospital, to do a modified barium swallow study so that we can make sure that whatever the issues are, it's something that you don't need to change your diet. And so that's also something. I believe that I'm giving another presentation on swallowing next month, is it? Or June? Yeah. So if you guys have specific questions and you want to come to that, just write them down so I can know exactly what to put in my presentation. I would love that. Makes writing presentations much easier. All right. Let me just, one more thing, and I don't know how am I going over? Am I too long?
We're going over a little, but if you're okay with it, then we are too.
Okay, if everybody's okay, I just have a few more slides. Let me talk about something called festination. Festination is the act of going at a normal tempo and then speeding up while decreasing your range of motion. So if this was somebody walking, they would walk, 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 fall over. That's festination. You've probably heard of it. And that's why we want people to do big therapy, right? So they learn to intentionally continue to walk. Same thing happens with speech. That's when you hear somebody start off with saying, yes, my name's Michele Demarest, but then they start to mumble. Yes, my name's Michele Demarest. I live at 800 Road North down there, right? And that's the typical Parkinson's presentation. And so that is something to be aware of. Your loved ones will be hearing you say that, speak like that. And, if that's happening, just know that that is all of those techniques will help you work on. Not just being loud, not just being clear, but using an entire sentence. And then, that'll be easier for you to communicate with everybody you love, your grandkids, etc. If you're going, by the way, if you're going to your doctor to get that FEES study, you could also ask them about the breather. Is it okay if I use one? We don't want people who have cardiac issues or lung issues particularly using this. So you would want to get released to do that too. Not everybody knows about it, but at least you could get an idea. All right. We're all about the strategies as speech therapists: speak slowly and clearly, use gestures and facial expressions. This will be the last fun thing we do. So one other thing we do is the lion. And, as you might have noticed, right, you maybe have a flattened facial affect. So what about that? Can you change it? The truth is, generally speaking, you can. And so just before we go, what we're going to do is the lion. And this is where we're going to put all of our facial muscles at their full range of motion. So it looks like this. Everybody watch it? So I am dying to see you all do that. So you saw what I did with my hands, my tongue, my mouth, everything's open. Awesome. I saw one person do it. Good job, Eden. Who else is doing it? There you go. There you go. All right. Do it again. Do it again. Good. Feels good to stretch, right? And that's an old yoga move, believe it or not. That's like a ancient Chinese yoga move. But boy, it works. And so doing everything that you can to your full range of motion is very useful. And then obviously, you know, a good strategy is to ask for repetition or clarification when you need it. And there are lots of other healthy habits. Your speech pathologist would talk to you about that as well and be supportive of you in those things. And as you know, their social engagement and support groups lead to longevity. It's you know, if you need a reason to want to be with others, just know that it's really documented well that if you get that support you need, it's helpful to you. And you know, this is for caregivers, you know, being open and supportive of people's choices, whether it is to get that help they want or they need, or that you think they need. It's important to reflect upon what it is they believe they need. And then opening it up to questions, if there are any, but I know we just ran over, but I'm happy to answer any questions.
Thank you, Michele. Someone did put in the chat that a question for the swallowing program. So I'll email you that question so that you can prepare. So if people want to also put that in the chat, or if they want to email me, eden@pmdalliance.org, I can put that in the chat. I really encourage everyone to save their chat. We put a lot of good information in the chat, including the website for Michele's business, the breather. We put a lot of good stuff. The interview with Michele, the book. So I really do hope you guys save your chat. If you go down, you can click on the three little dots that say more next to your chat. What did you say? And that's how you save your chat. So a lot of great links in the chat. We have a tradition here at PMD Alliance, our wave of gratitude. Thank you so much, Michele, for being with us today and for coming back as well to do swallowing. I hope everybody had a wonderful afternoon, and thanks for being with us today. Bye, everyone.
Let me say one more thing. You know, a lot of people are thinking, how in the world am I going to leave my house and get to speech therapy? The truth is, a lot of this can be done online these days. A lot of it. Even some of the swallowing, although we're more careful about that. But just so you know, you can do it from the comfort of your own home. And that is fine. It's supported by your insurance. And so just so you know. So, okay. Thank you.
Bye, everyone.
Bye.
Thank you.